Thank you for joining us and welcome to Better Together Live, where we create helpful community connections when it matters the most. I am Yamile Bauman, your host and the Community Relations Coordinator here at TherapyWorks. Today, I'm happy to be joined by Jeannie Anderson from the Good Samaritan Hospital. Welcome, Jeannie.
Thank you.
We started Better Together Live to highlight local resources like Good Samaritan to offer expanded access to support for our local community. We hope you find these conversations helpful. Jeannie, thank you so much for joining us. And please, the floor is yours. Tell us about you.
Thank you, Yamile. Well, it's so nice to be here. And I just want to say, as far as community resources, we love TherapyWorks. We're very familiar with your services. And what I always feel good about when I'm referring a client, as you know, the importance of sending a client to a therapist, especially when they're discharging from our care here, is that they have the outside community resources.
Correct.
And we love TherapyWorks. I always feel so confident in the therapist there, and I know Malaya well, and I know you well, and I feel like I know that they're going to be in good, safe, hands. That everyone is very knowledgeable there in what they do.
Thank you.
Just wanted to say that. Yeah. So
I appreciate that. Thank you.
A little bit about me. I am a licensed LADAC. I'm a licensed addiction professional by trade. So I've worked in the addiction field for many years. I actually started my career here at Good Sam in 1999. A lot of you don't know that. Yeah. I go way back when Roland Williams was the executive director, and I started in 1999 as a volunteer. I started running some of the aftercare groups, and I had such a passion for helping people in the field that at that time I decided to go back to school and get my degree in addiction counseling. And, I continued here working in all the departments and running the groups. And I left for a short while. I went to Bayside Marin when it wasn't even known. It was only treated 6 patients at a time.
At the time,
at Bayside. So I was there for the startup of Bayside when actually the first patient was there the first day. It was before Acadia Healthcare had bought Bayside. And what I loved about working on site at a residential facility was just the clinical experience that I received working there for 2 years. So after that, I was always back at Good Sam. I worked for a company called CRC Health for 10 years. But during my time at CRC, I was always back in the evenings helping out here at Good Sam.
Your heart was there.
My heart was there. Yeah. So almost 5 years ago, I got a call and from one of the directors here, and she said, we have a full-time opening for physician-provider relations, which is, networking and outreach, clinical outreach, and connecting our providers and physicians in the area to our services, and we think you'd be perfect. And she said, plus it's time for you to come home. And I said, you're right. It's always been my home. So, my heart has always been here. I've never really left. So now I'm back full time.
They are lucky to have you. That's all I'm saying. You're an absolutely incredible person. Yes.
So sweet. Thank you. I'm really happy to be able to be, the front face of such an important, service that we provide here in our hospital. I love all our departments in the hospital. They're very unique. Good Sam is known for delivering babies, right? We have assistants over at the big hospital, and everyone I meet always says, "Oh, I was born at Good Sam," or "I had my baby at Good Sam." So I think a lot of people don't know too much about our behavioral health services, which I was so excited to talk with you.
Yes, and you're absolutely right. I mean, before I started doing this job, and I did not know that, Good Sam had this expanded behavioral health, mental health side of the hospital. So if you can talk to us, I know you guys have the bipolar, depression, anxiety, and substance abuse. If you can talk about that, that would be great. So we can all know.
Absolutely. So we have, first off, an 18-bed inpatient acute unit.
Oh, that's pretty big.
For someone who needs, and let me tell you what I love about our unit is all the rooms are individual. So, and it's only 18 beds, so it's small enough to where patients really get a lot of individualized care. I like our inpatient stabilization because they're in groups, they have occupational therapy, they have nutrition, they have exercise, art therapy. I love going into our unit, seeing patients come in, you know, bipolar, psychosis, severely depressed, and then I go back like every couple of days and check in on them, and I love to see
the difference. Yeah,
I see the difference, and I see them joining in the community room for their meals, and they're starting to come out of their room, and so awesome. I love that we offer that acute piece, especially when someone doesn't feel safe. I had a call a while back from a patient, an elderly gentleman who called me from his home and said, due to COVID, he had been isolated in his home for months, and he was feeling so suicidal and depressed. He said, I just have to get out of here. I don't know what to do. And he came to our emergency room because right now with COVID, we're having everybody go through the emergency room that needs attention so they can get screened, make sure that they have no symptoms, they're safe. And the next day he was on our unit, and you know, I was so glad to see that he made it out of his house and onto the unit. So
I'm impressed that he made that call.
He made the call.
Yeah.
He said, I have to get out of here. I have no, he said, I have no friends, hardly. My family is all at a distance. So I'm alone in the Bay Area. And he said, I'm completely isolated. And I said, you need to get out and let us help you. And so he came in, stayed in our unit for a few days, started feeling better. We found him some community resources he could connect with so he wouldn't have to be so isolated.
Are you doing some like group therapy, group support therapy?
So in our inpatient unit, yes, we have our social workers provide group therapy twice a day. They have groups. And then they are also discharged with many resources when they leave our inpatient program, which leads me right into our full continuum of care. We have outpatient services. So many of the patients that step down from inpatient step down to our partial hospitalization, which is 9 to 3 daily with lunch included. And we really work in outpatient, in partial, particularly to stabilize the symptoms, to continue to stabilize the symptoms. So they see a psych nurse, they see a psychiatrist once a week, they see a medical general practitioner while they're in our program. So our PHP level is our second highest level of care that we offer. We're in network with all insurance, which is very good for a program, and we take Medicare. So Medicare is a nice resource for people on Medicare with disabilities or elderly people who want to come into a program. So, and then we have intensive outpatient for substance abuse and psych. So you don't have to have a substance abuse to come here. It can be primary psych. We're very good at the psych piece. We're also very good at the chemical dependency piece. So we offer both the dual diagnosis groups. The straight CD, if there's no psych, we put them in our straight CD. And many times we find that they're opening up a lot about mental health while they're in our substance abuse.
The substance abuse,
They're talking about anxiety. They're talking about underlying depression. So they're a very good fit in our dual diagnosis program. Once they complete our programs, we have alumni aftercare. For patients, and they can come as long as they'd like. We have patients that have been here for years in our alumni group. Right now, they're coming via Zoom. So, you know, because the alumni group can get kind of large, so we have to keep that at a minimum. But, you know, I love that we have the patients that are in alumni, and then if they're struggling, they're not doing well, a lot of them say, hey, you know, can I come back for a tune-up? Can I come back into the program? So, you know, one of your questions was, what is your favorite thing about working at Good Sam? I think I have to say it's those unique and priceless relationships that I see here with our patients.
I bet.
Many of them are they're just priceless, and they've been here for so long, and they do so well. And if they struggle, they know where to come back to get plugged in. We know you just don't go through treatment, you're instantly well, right?
No, it's a process. It's a long process.
It's a lifelong journey. So, you know, and another addition to our outpatient programs, we have a very unique, what's called an older adult program that meets once a week for patients 65 and older.
Oh, I didn't know that.
issues related to grief, loss, trouble with medication, death of a spouse, things they're going through. So that's a nice group.
It is a nice group. Wow. So let me ask you this. When you're doing all this, are you guys including the family of your patients to be active with them in, the group therapy or individual therapy? Do they come?
Yeah, they do. That's been challenging during COVID. We used to have family groups, family program once a month for all the family members to come. And then weekly, they would have check-ins with the family to talk with their loved ones. They could have an open conversation with their case manager. Right now, they're doing just by phone. So the family program is not yet on telehealth. We do have telehealth for our PHP and IOP for our patients only. But we're talking with families on a case-by-case basis as needed. If they call in about their loved one or the patient requests a family conversation. COVID's been a little bit, different. We've had to really restrict any kind of family visitation on the unit, which has been hard. But the family component is really important to our program.
It is for the well-being for everybody. Yeah.
It is. Yeah. So
what makes Good Sam stand out? And I think I know the answers, but I wanna hear from you.
I think Good Sam is known as the program with the heart. I think it's our caring staff. It's our hospital-based environment. I think patients feel very safe and well and cared for. But I would say it's our clinical care. I think that each of our therapists and our staff here just really have caring attitudes. That's why they're here. That's probably why we do what we do. Our nurses on our inpatient unit are very well seasoned. Some of them have been here over 20 years and have received the Daisy Awards and just for their outstanding care. And I sometimes you go to places and there's a lot of turnover and you see, burnout and things like that. I don't see as much of it here. I see people really stick around for a long time.
And that's great. That tells you something, right? Yeah.
I think our clinical care, now there's a lot of new wave programs. You've got some competition programs that have brain spotting and all these wonderful things, which I love to see new things come into the field. While we may not be as colorful and decorative as some of the newer wave programs, I feel that the clinical care here is very sound and very stable.
It's excellent. Yeah, I agree. I totally agree with that.
Yeah. And not to say that we don't keep up on new wave things.
No, I know you do. Yeah.
HCA, Good Samaritan is owned by HCA, Healthcare, Hospital Corporations of America, which HCA is one of the largest healthcare organizations in the world. We are, you just look it up on the internet, and our mission is to treat each patient with human, dignity and respect. And they have a lot of old world mission values, which I really like. And they do put a lot of money into, research and, talking about maybe developing an ECT program here, electroconvulsive therapy for our inpatients. So we're always looking at new opportunity.
Yeah,
absolutely. It's not to say we're in a dinosaur age, but you do see some of the newer programs that have a lot of different new interesting things. So I think HCA has really done a good job as far as trying to really look at what we can implement and always look at engaging new things into it.
Yeah, that's great. That is great. And it has to be like that.
It has to be.
Yeah, to keep up with everybody else. But I think you guys have done a great job. You are. So let me ask you this. How are you finding ways to stay connected to your community, your colleagues, your clients, your friends, family during this time?
Great question. I have weekly team calls with my physician provider relations team that are based across the United States. We have weekly Zoom WebEx meetings, and I love that. And every week someone has an opportunity to share kind of what's going on in their area. So that keeps me really connected with my team. I also have a team that I work with over at the main hospital, and we are doing weekly calls. I think I'm missing so much some of my large networking events in the community. We used to get together, oh my gosh, a couple of times a month, right, Yamile?
Yeah, I remember. Yeah.
And everything is telehealth. So just really enjoying at least being able to stay connected, with technology. And when we can in small gatherings, getting together. There's been a few of us who have met, and it's just so nice to see people individually and be able to stay connected, as a sense in our community.
That's
Community
right.
resources. I love NAMI, National Alliance for Mental Illness.
Mm-hmm.
We're big fans of NAMI here. Personally, I also love Alcoholics Anonymous. I think it's an evidence-based program that for our people struggling with addiction, that even though meetings are not in person right now, AA continues to jump right in with technology and offer Zoom meetings around the clock. And you can actually go to meetings in different parts of the world now because
that's right. Yeah, it didn't cross my mind, but you can totally do that.
I can go to a meeting in Ireland and see what they do there, and it's kind of neat. So I really like that they're keeping people with addiction and mental health, issues connected via the internet. And family and friends, just trying to see my family as much as possible in small gatherings, dinner, and things like that. But it is a challenging time. But I think our immediate community in mental health, including TherapyWorks, has done an amazing job of keeping patients connected.
Yeah, it was very smooth transition for us, TherapyWorks, from face-to-face, in-person, sessions to telehealth.
Yes.
It was very nerve-wracking at the beginning, but everything was very, very smooth, and it was a great thing. Yes. And we're busy.
Yeah.
You guys are busy. Yeah.
But yeah, it's a busy time. We need to be busy right now to provide for the people that are struggling. And a big topic for ourselves as clinicians is self-care as well, and taking care of ourselves and others, right?
Right.
Our support.
I'm curious about what do you do for that? What do you do? What are your favorite things to do to de-stress?
I have to say my dogs are a big part of it. I have a beautiful 9-year-old German Shepherd.
I love German Shepherds.
And I'm in the process of getting a new puppy. He's also a German Shepherd. He's not here yet. He's too little to leave his mom, but he'll be with us soon. So I can't believe I'm starting over. But I think for me, animals, give me such a sense of grounding in my life, and just spending time with them. I was also fortunate this year to move to a beautiful home in the mountains.
I know.
So being out, and I cannot wait to have you all over. Being out in nature right now has been really, really healing. Have the ability to spend many evenings that have been nice weather so far outdoors in the fresh open air, and so that's been really nice. I still am very connected to my faith. That's very important to me.
It is.
Maintaining a sense of faith and community that way has been essential in my life. And I think talking daily to my family helps tremendously too. So that's a good thing.
I think everybody collectively, we are more in touch with what we have. We're more grateful because there are things we couldn't do. Very simple things we just can do, like hugging someone, which I'm a big hugger. I'm South American. I'm all about all this.
Outdoors.
Outdoors. And, it's just such an important part of our lives, right? Be connected to people. And I sound like a broken record, but I think it's very, very important, the face-to-face interaction with people.
Yeah.
The love and care that one another, right?
Absolutely.
It's making us think a little bit more in this time. This is really, really good. Is there anything else you want to add? Maybe your information, how can people contact you?
I love to give my phone number out as a resource. There's nothing that makes me happier that when someone calls me directly or a doctor calls me directly and says, I have a patient or even a family member that I need some advice with, and it just makes my heart happy that I help.
Perfect.
You can reach me at my work phone through Good Sam is 408-355-5470. And my email is Jeannie, it's spelled the old-fashioned way, JEANNIE.Anderson, ANDERSON, @hcahealthcare.com. So you can reach me both ways. I'm always here to answer any questions or offer a sense of support.
Perfect. Thank you so much for sharing your information. And I want to be respectful of your time. And
Thank
I just
you.
want to say this again. Our philosophy here at TherapyWorks is very simple. We are better together. And everything we do is to support our community. And we understand that reaching out for help is not always easy, but when you're ready, we're here to help. If you want to learn more about TherapyWorks, visit us at mytherapyworks.com. Thank you so much, Jeannie. This was wonderful. And I hope I will see you soon.
Perfect. Thank you so much, Yamile. It was just an honor to be here and part of the TherapyWorks team. I just love all of you there. Thank you for all the work you do in the community.
Thank you so much. You have a wonderful week.